Hi, I'm Nicholas Andrade with Nightingale College, and this is my Community Health Improvement Plan. Sacramento, California, my home and the community I selected for my Community Health Improvement Plan is a diverse and rapidly growing metropolitan region known for its agricultural and cultural history. Officially recognized in 2012 as America's farm to fork capital, Sacramento sits as the heart of one of the world's most productive agricultural zones. The Sacramento County spans roughly 1,000 square miles, stretching west from the fertile delta lands between the Sacramento and San Joaquin River to the foothills of the Sierra Nevada mountains. It spans north to the Central Valley and south into the San Francisco Bay. Its Mediterranean climate, marked by long, hot summers and cool, damp winters, supports year-round farming and contributes to the region's identity as an agricultural epicenter. Despite this abundance of fresh, locally sourced food, Sacramento continues to face significant nutrition-related health challenges. More than a quarter of residents live with high cholesterol, hypertension, or obesity. These rates are comparable to communities with far fewer healthy food resources. As a community health nurse, this contrast prompted me to explore the factors contributing to these outcomes, including chronic disease patterns, infectious disease trends, and the broader health risks that are prevalent throughout my community. Sacramento's economic market is led by government and real estate, with healthcare, education, technology, and, of course, agricultural followed closely behind. The county is served by 43 healthcare facilities, including hospitals, clinics, and primary care centers, resulting in approximately one primary care physician for every 1,090 residents. Educationally, Sacramento is home to five public colleges and universities, more than 15 private institutions, and eight K through 12 school districts. The region also supports extensive transportation infrastructure, including an international airport, three general aviation airports, and a public transit system operated by Sacramento Regional Transit. According to 2024 census estimates, Sacramento County is home to roughly 1,611,000 residents with an almost equal gender distribution of 50.8% females and 49.2% males. The community is culturally diverse, with 21.3 residents born outside of the United States. Approximately 22% of the population is under the age of 18, while 16% is over the age of 65, creating a broad spectrum of age-related health needs. Between 2020 and 2024, it was estimated that 63.4% of residents over the age of 16 participated in the civilian labor force, with a median household income of about $92,000. This county contains more than 600,000 housing units, 59% of which are owner-occupied, with a median home value of $534,200, an average household size of 2.6 people. Beyond its demographic and economics, Sacramento also offers a wide range of community assets that influence health and well-being. Sacramento is home to a wide network of social support systems that strengthen the community and promote overall well-being. The region has dozens of sports leagues, recreation groups, religious organizations, volunteer programs, support groups, and community partnerships that offer residents meaningful ways to connect with others. Access to these resources is broad and advertised throughout community centers, community websites, and various neighborhood associations. Beyond these formal organizations, Sacramento is promoted as an active lifestyle community with a network of park, bike trails, and parkways. Cultural events include seasonal farmers markets, cultural festivals, and neighborhood events that are hosted at easily accessible spaces for residents to gather and stay active. While Sacramento is rich in resources, opportunities, and cultural diversity, these benefits are not experienced equally across all neighborhoods. Significant disparities exist in chronic disease rates, access to care, environmental exposures, and socioeconomic conditions. As a community health nurse, what stands out most is the gap between Sacramento's resources and the health outcomes of its residents. While we are meeting the targeted metrics for Healthy People 2030 in several categories, we are also higher than national averages in others. The data reveals that many individuals continue to face significant chronic health challenges. In Sacramento County, we see high cholesterol affects 32.4% of adults, which is an increase from the city's prior value of 30.4%. We also see high blood pressure affects 29.7%, which does meet the healthy people goal for 2030 of 41.9%. We also see that 11.2% of adults live with diabetes, which is lower than the US national average of 12%. Additionally, 10.2% have asthma, which is higher than the US national average of 9.8%. And lastly, 5.3% of Sacramento residents have been diagnosed with coronary heart disease, which is lower than the US value of 6.4%. Chronic disease is only one part of Sacramento's overall health profile. In addition to these chronic health conditions, Sacramento also faces a significant burden of infectious diseases. From a community health nursing standpoint, it is important to recognize these health challenges as equally important when surveying the community. Surveillance data reveals that several communicable illnesses continue to affect residents across age groups and neighborhoods. These cases are calculated based on the annual cases per 100,000 persons. Chlamydia incidence rates are at 461.8. Gonorrhea incidence rates are at 199. Syphilis incidence rates are at 132.5 of 100,000 people, and the Healthy People 2030 goal for syphilis is 33.9 per 100,000 people. The Salmonella infection rate is at 15.3 with a Healthy People goal of 11.5 per 100,000 residents. In Sacramento, the HIV diagnosis rate is 11.7, and the death rate due to influenza and pneumonia is 9.4 per 100,000 residents. The Healthy People 2030 goal for tuberculosis is 1.4 per 100,000 residents, while in Sacramento, we have a tuberculosis incidence rate of 6.9 per 100,000 people, which we are not meeting. These numbers highlight the ongoing need for targeted community health interventions and a deeper understanding of the factors driving these disparities. Additionally, there are Healthy People 2030 goals that Sacramento is not meeting, including the amount of patients who have had mammograms in the past 2 years between the ages of 50 and 74. The targeted goal for Healthy People 2030 is greater than 80.3%, and currently we are at 73.1%. The Healthy People targeted goal for adults who are sedentary is less than 21.8%, and currently Sacramento is at 22.4%. The Healthy People 2030 goal for residents who get insufficient sleep is less than 26.7%, and currently Sacramento residents are at 38.9%. The workers commuting by public transportation, Healthy People has set a goal of greater than 5.3%, while Sacramento is currently at 1.9%. And lastly, the people living below poverty level, the Healthy People goal is less than 8%, while Sacramento is currently at 10.3%. While both chronic and infectious diseases persist as top concerns, they represent only two factors of a multidimensional health challenge for Sacramento residents. Equally important are the underlying risk factors that contribute to chronic illnesses and poor health outcomes, many of which are preventable and deeply connected to lifestyle, environment, and access to care. The health of our community is shaped by risk factors, including the following. The high rates of adults with obesity is at 30%. Adults with sedentary behavior are at 22.4%. Binge drinking in the last 30 days is at 14.3%. Tobacco use is at 13.1%. And the number of adults without health insurance is at least 10%. These factors not only increase the likelihood of chronic disease, but also deepen existing health disparities across neighborhoods. Despite Sacramento's abundant access to fresh, local foods, many residents continue to make dietary choices that increase cardiovascular risk. Based on the chronic disease data from Sacramento County, high cholesterol prevalence of 32.4% stands out as a major contributor to coronary heart disease. While data suggests that coronary heart disease is only diagnosed at 5.3% prevalence in Sacramento, most cases of coronary heart disease go undiagnosed. According to the National Heart and Lung and Blood Institute, there is about 1 in 20 adults aged 20 and older who have coronary heart disease, but many people don't know that they have the disease until they have chest pain, the blood flow to the heart is blocked, causing a heart attack, or their heart suddenly stops pumping blood, which is also known as cardiac arrest. The accumulation of cholesterol and obesity rates are risk factors that can be mitigated through education, which is why the focus of my community health improvement plan is on reducing high cholesterol through improved dietary habits and lifestyle choices. The educational strategy which will be implemented will be a free, community-based luncheon seminar combining a short lecture with hands-on food analysis sourced from local farmers markets. The target goal for this session is that by the end of the 60-minute teaching session, participants will verbalize 2 lifestyle changes, such as increased physical activity or reduced alcohol intake, that support cholesterol reduction. Within 6 weeks, participants will demonstrate the ability to create a weekly meal plan incorporating at least 3 locally sourced heart-healthy foods. Within 3 months, 70% of participants will be able to identify at least 5 heart-healthy food options available in Sacramento's farm-to-fork restaurants and farmers markets. This hour-long session will be led by a community nurse and nutritionist and will be delivered as an in-person group hosted at various community centers throughout the Sacramento County. We will explore real Sacramento restaurant menus and farmer market produce to build practical skills to support behavior changes when dining and selecting meal options. Evaluation methods will include a pre- and post-session knowledge check to determine baseline understanding and post-teaching understandings of LDL and HDL cholesterol. Participant demonstrations of meal planning skills will also determine the readiness and level of understanding. We will provide a self-reported goal-setting worksheet which will be collected at the end of the session and provide a follow-up survey at 4 and 12 weeks to assess behavioral changes. According to the National Heart and Lung and Blood Institute, for most people, coronary heart disease is preventable with a heart-healthy lifestyle and medicines. You may be able to stop or reverse plaque buildup in coronary arteries. Together, these strategies aim to reduce cardiovascular risk by providing Sacramento residents with the knowledge and confidence to make healthier dietary and lifestyle choices. While Sacramento faces ongoing health challenges related to chronic disease, infectious disease, and cardiovascular risk, the community is also subject to environmental threats posed by its unique geography. The same river system that supports Sacramento's agricultural identity, the Sacramento and American Rivers, also place the region at significant risk for flooding. Flooding greatly endangers public health and is an urgent concern as rapid growing population growth in flood-prone regions and more extreme weather events will increase the number of people at risk. The aging levee system, heavy winter storms, and snowmelt runoff from the Sierra Nevada mountains make Sacramento one of the most flood-prone metropolitan cities in the United States. A major flood event could result in widespread displacement, infrastructure damage, and major public health consequences, particularly for communities located along the several river pathways in Sacramento. Flooding events are associated with increased death rates for cardiovascular disease, infectious and parasitic disease, injuries, and respiratory illnesses, according to NIEHS-funded research. As with other health challenges facing the community, understanding the disaster risk is essential for planning an effective emergency response and protecting Sacramento's residents. In a major flooding disaster, certain groups within Sacramento would face higher risk due to their social, economic, and health-related vulnerabilities. Although residents living closest to the Sacramento and American Rivers would be most immediately affected, 4 populations stand out as particularly vulnerable. Older adults and children facing heightened risk because of their mobility limitations, dependence on caregivers, and increased susceptibility to injury, illness, and disruption of medical routines. Low-income households are also at greater risk as they are more likely to reside in flood-prone areas, have limited access to reliable transportation, and possess fewer resources to support evacuation or recovery. Sacramento's large unhoused population would experience significant exposure to floodwaters, with limited access to safe shelter, sanitation, and medical care during and after a flood event. Additionally, immigrant and non-English speaking residents may encounter barriers in receiving emergency alerts and understanding or navigating evacuation instructions and relief services. These vulnerabilities highlight the importance of disaster preparedness and disaster response planning across Sacramento County. A flooding event in Sacramento would introduce several significant health concerns, particularly for residents already facing chronic conditions and limited access to care. One of the most immediate risks is the spread of waterborne illnesses. We observe higher infectious and parasitic disease rates within 1 month after very severe events for all floods, which suggests that exposure pathways may be similar across flood causes. The delay likely reflects disruptions to drinking water and sewage infrastructure that can lead to water-prone disease transmissions. Floodwater often contains sewage, agricultural runoff, and chemical contaminants that can lead to GI infections, hepatitis A, and skin or soft tissue infections. In addition to infectious risk, flooding greatly increases the likelihood of injuries and trauma. Injuries can occur from lacerations from debris, falls, hypothermia, or other dangerous environmental hazards such as electrocution from submerged electrical lines. A third major concern is environmental exposure from floodwaters that are carrying pesticides, industrial chemicals, fuel, and other hazardous substances that pose health risk. These exposures can cause respiratory irritation, chemical burns, and pose acute and long-term health risk. Together, these health issues show how a natural disaster can pose a high health risk to the community. Because these health threats can escalate quickly during a disaster, frontline nursing actions play a critical role in protecting community health when formal emergency services may be delayed. Identifying health outcomes associated with distinct flooding causes is critical for effective disaster and public health preparedness, as development patterns and climate change amplify flood risk. One of the most essential interventions for nurses is rapid triage and basic first aid, which includes assessing residents for injuries, cleaning and dressing wounds, controlling bleeding, and identifying individuals who require urgent evacuation. Nurses also provide health education on water safety and contamination prevention, helping residents avoid contact with floodwater and practicing safe handling with food and drinking water to reduce the risk of waterborne illnesses. A third nursing intervention involves supporting vulnerable populations through rescue coordination. This may include assisting older adults or individuals with disabilities, identifying residents who have lost access to medications or medical equipment, and helping families secure safe shelter, clean water, and basic supplies. Together, these interventions help stabilize affected residents during the critical early stages of intervention following a flood. In conclusion, Sacramento is a community defined by its rich agricultural resources, cultural diversity, and strong social networks, yet it continues to face significant health challenges that affect residents across neighborhoods. The prevalence of chronic disease, infectious disease, and lifestyle-related risk factors highlight the need for targeted, community-based interventions like the Community Health Improvement Plan, which aims to empower residents with the knowledge and resources needed to reduce preventable diseases. Sacramento's geographical vulnerability to flooding also highlights the need for disaster planning and nurse preparedness. Ultimately, improving the health of Sacramento requires a coordinated effort between community nurses, which can support residents in making sustainable lifestyle changes that can contribute to a healthier future. I'm Nicholas Andrade with Nightingale College, and this has been my presentation on Community Health Improvement Planning.